I'm a fellowship-trained breast surgical oncologist, and recently someone asked me to please make a video on triple-negative breast cancers. This is not my patient, and this is a made-up case, but this is a 30-year-old female who felt a lump about the size of a marble within her breast. It was pretty close to her skin, so she could feel it clearly. She went to her OBGYN, who examined her and felt it as well, and sent her for an ultrasound as well as a mammogram. This is what the ultrasound showed. You can see that this lump does have jagged edges. It is taller than it is wide, and it has what we call posterior acoustic shadowing, which means the black shadowy area right under it. She underwent a biopsy and was found to have a triple-negative breast cancer. Her cancer was a stage 1, and it was 1.8 centimeters. She had an MRI which didn't show any other areas of disease within the breast, so she opted for a lumpectomy. And here's the lumpectomy that she had. You can see the clip is right in the middle. The Savvy Scout is pretty close as well. She also had a sentinel lymph node biopsy, meaning that she had 2 lymph nodes removed from under the arm to confirm that she did not have cancer in them. And her final pathology showed that the cancer was actually 2.1 centimeters, and the lymph nodes were clear. We do see this kind of difference between what we see on imaging and what we see on the final surgical pathology because imaging studies aren't perfect at estimating the size. But because her tumor was now greater than 2 centimeters, she was eligible for not only chemotherapy, but immunotherapy called Keytruda as well. Keytruda is something that can be offered to people who either have a primary tumor greater than 2 centimeters or a tumor less than 2 centimeters in size, but involving one of the lymph nodes. She ended up doing the 8 cycles of chemotherapy with immunotherapy recommended, and then the duration of a year of immunotherapy. And 5 years passed by and her cancer never came back. She also had whole breast radiation, and 5 years down the line, she was very happy with her decision to preserve her breast and continued to get mammograms and MRIs every 6 months.